We've heard about bone marrow transplant. Can you tell me a little bit more about the exact process of what a patient has to go through when they have a bone marrow transplant?
When we identify a donor and they've been cleared medically, we're ready to begin the process. The patient is generally hospitalized and then they receive high doses of chemotherapy. And it's generally two different types of chemotherapy to really serve two purposes. One is to suppress the disease, but the other really is to just suppress that patient's immunity so they can't reject their new source of stem cells. After a few days, when that drug is out of their system, then those stem cells from the donor can be given as an intravenous infusion. Once they're in the body, they will circulate throughout the body, but they have specific adhesion antigens they'll recognize when they're in their home, in the bone marrow, and stay there and then latch on and begin to grow. What we expect to see after that is the counts will begin to drop. The platelet counts will get very low. The white blood cell counts will get very low. The hemoglobin will drop and they'll need to get red cell transfusions and platelet transfusions. And there's a window, on average around 2 to 3 weeks, where the counts are very low before that new source of stem cells begins to grow sufficiently where they're making now their own white cells or platelets and red blood cells. So on average, they're in the hospital for about 3 to 4 weeks. The major side effects that we're dealing with are mucositis, irritation to the mucous membrane, mainly from those high doses of chemotherapy that were administered. And of course, if your white blood cell count is low and you're having leaky membranes, infection is the second most common issue that we're dealing with. People empirically get on antibiotics and they stay on them and they're adjusted depending on what they're dealing with, if it's a bacterial infection or fungus or viral. And they're also started on antibiotics that'll help prevent viral infections from reactivating within the body. Overall, patients can expect from the day they receive their stem cell infusion to the day their counts recover enough, on average it's around 3 to 4 weeks before they can leave the hospital.
And so once they leave the hospital, typically, what's next steps? How long do they need to be followed, at the transplant center?
Once they leave the hospital, the two things that we're monitoring most closely is the onset of graft versus host reaction. If it occurs in that first 90 days, we consider that acute graft versus host reaction, or the early form. If it occurs after the first 90 to 100 days, we call that chronic. And it means it's a late recognition of the donor from that new graft, and it can last much longer. Also, during that first month or two after discharge, they're at risk for reactivation of viral infections. One specific one is CMV, cytomegalovirus, that we worry about the most. So we tend to recommend that the patients stay near the transplant center for about 3 months before patients are allowed to go home. They still need to be monitored on a regular basis for chronic graft versus host disease, and if they have it, for adjusting their immunosuppressive medications.